welcome to Mayday 2024. I think we have an exciting program for you today to celebrate knowledge activism in terms of our history, OHCOW's history, the labor movement's history and occupational health and safety history, but also then USW and the role they've played. And then we'll have some research to share about knowledge activism and how its effectiveness in workplaces. And then the arc of that also in celebration of John's 35th anniversary at OHCOW, which happy anniversary, John, as well as OHCOW's 35th anniversary, which happened in February. We want to talk about then how we got into the workplace mental health field, and then our work with the COPSOC and the mental injury toolkit, and then where we're going into the future. So it's a Mayday celebration, and we really appreciate everybody joining us today. I think that we are set. Are we set, Tony, in terms of the
Yes.
YouTube? Okay, we're broadcasting live on YouTube. And also, we will put an edited version of the recording up in a few days. And so I think we will start by introducing our first speaker. We had about 100 people signing up, but we usually only get about half come the day of, and then the rest watch later. So Sylvia Boyce is our first speaker. She's director from the National Office of the United Steelworkers and also on OHCOW's board of directors, and a long-standing supporter of OHCOW provincially as well as locally from the Hamilton Clinic, which is where I'm based, as well as John. So Sylvia, I can't access your bio right now since I confused my screen trying to see about projecting the slides. So please, I'm welcoming you, and please introduce yourself further. Thanks.
Good morning, everybody. I'm excited to be here with you all. I thank Val and OHCOW for the invitation. I want to congratulate John O'Dyke on his 35 years. John is an amazing individual. He's an expert in health and safety, and he's been a huge support to USW members across Canada and the US. And I want to congratulate OHCOW on their anniversary as well. As Val said, I am the head of the Health, Safety and Environment Department for the United Steelworkers Canadian National Office. And I do sit on the OHCOW Board of Directors and the Workers' Health and Safety Center and many other boards. And I also, prior to working for the United Steelworkers, I was a registered nurse for 17 years. So I'm going to talk to you today. My presentation is about making a difference in knowledge activism on a community scale. And I would like to acknowledge my colleague, Andy Lattiser, who is a District 6 Health and Safety Coordinator for Ontario and Atlantic Canada. Andy is unable to join us today, but he's been very much a significant part of the work that we do in health and safety. And he actually has put together this presentation that you'll see today. So I'll go ahead and begin the presentation. So if anyone has attended the Elliott Lake 50th anniversary event in April, then you will see there'll be a little bit of familiar content here today. We were asked to share that information at this event, and we have added a few additional examples of knowledge activism. Thanks. PowerPoint. So this here is a slide of the Miners Memorial in Elliott Lake. Anyone who has visited Elliott Lake or read about Elliott Lake in the news would know about this Miners Memorial, but not everyone knows the history behind it. Workers at Elliott Lake knew that their job was compromising their health and safety, and they saw their coworkers dying from silicosis and lung cancer. Miners were required to have a yearly chest x-ray to see if there were signs of silicosis. And despite this yearly check with workers being cleared by the compensation board to work based on the x-rays, many workers were still getting very sick and dying from silicosis and lung cancer. That should have been detected in those x-rays. To add insult to injury, the Compensation Board denied many of the occupational disease, or known at that time industrial disease, claims for silicosis and lung cancer. It was known to the workers and to the USW that the uranium exposures weren't safe, and that the exposure was the cause of so many cancers and illnesses among the workers. They knew it, but they couldn't prove it. So they asked the government if there were any studies about the effects of uranium exposures on miners, and were told that no such studies existed. Then members of the USW from Elliott Lake attended an international symposium on uranium protection in Bordeaux, France, only to hear from a representative of the Ontario Ministry of Health, who gave a presentation on the second day about the effects of uranium exposures on miners in Ontario. It was the government's deceit, the unjust denials from the Workers' Compensation Board, and the terrible, oops, my slides. Oh, there we go. Sorry. It was the government's deceit, the unjust denials from the Workers' Compensation Board, and the terrible working conditions that prompted the Wildcat strike in Ontario, in Elliott Lake, on April 18th, 1974. And that's when they closed off access, off the access road to the mine from the Highway 108, and they launched a Wildcat strike. And among their demands was a list of 54 health and safety issues they wanted addressed. Some miners tried to plead for help from the Minister of Labour and the mining head office in Toronto a few days later. When the Prime Minister was in Sudbury on April 27th, some miners gathered outside the hotel that he was staying at, hoping to get his attention, to no avail. An Elliott Lake miner, Origine Tellier, was suffering from silicosis as well as arthritis at the age of 53, to such an extent that he required a wheelchair. When he started working in the mines, he weighed 150 pounds, but due to illness, he was only 80 pounds when this picture was taken in 1975. And this is just one example of a miner in Elliott Lake suffering from workplace exposures. They were fighting to prevent others from contracting deadly diseases such as silicosis and lung cancer due to the horrible working conditions. In the first 3 months of 1974, there were 107 workers who received pensions for silicosis. Most of the denied claims in Elliott Lake were for lung cancer and other conditions. Because it was before, it was widely accepted that silica as well as radon cause lung cancer. The Ham Commission. And in this picture, you'll see Dr. James Ham, Gib Gilchrist, and Ken Valentine. Their efforts were impossible to ignore, and that the government was forced to take action to protect workers. It was the Wildcat strike that led to the Ham Commission and the resulting legislation that is our Occupational Health and Safety Act. In 1978, the Ontario government passed legislation known as the Occupational Health and Safety Act in response to the concerns of the miners in Elliott Lake. But the federal government stepped in and stated that uranium mining was federally regulated, which meant that the new legislation didn't apply to the miners in Elliott Lake. Their fight wasn't over, and the Canada Labour Code was amended to provide equal protections found in the Occupational Health and Safety Act. Those protections were later incorporated into provincial legislation in other provinces and territories. So, the fundamental rights, the right to know about the hazards in the workplace, the right to participate in protecting in your health and safety, and the right to refuse unsafe work are a part of every jurisdiction's health and safety legislation. Elliott Lake miners are who we need to recognize for fighting to get workers those fundamental health and safety rights. Like every fight for workers' rights, those miners paid for it in blood, sweat, tears, and the loss of life. Now I'm just going to talk a little bit about the origins of OHCOW. It's never been an easy road for injured workers to receive compensation, and claim denials were, and still are, the norm. Family doctors are unfamiliar with evaluating occupational diseases. The first union-sponsored occupational health clinic in North America was started by the United Steelworkers Local 1005 in Hamilton in 1981 in conjunction with doctors from McMaster's Occupational Health Program. And then building on its success, the Ontario Federation of Labour secured an agreement with the Ministry of Labour in 1988 to fund a pilot project, leading to the creation of OHCOW's first clinics in Hamilton and Toronto in 1989, which in turn has now led to OHCOW having offices in several locations to serve all workers in Ontario. We have 7 clinics in Ontario. And OHCOW has been just an invaluable resource to all workers, to the communities, to labor, to employers. And OHCOW has worked with USW at various occupational disease clinics with locals from Sault Ste. Marie, for Algoma Steel. In Sudbury, we had Valet and Nylon Castings. And then in Kitchener, the Rubber Workers Project. The picture shows an overview of what happened on May 9th, 1992. Westray was an underground coal mine in Plymouth, Nova Scotia, and it was only opened for less than 8 months. At 5:20 a.m. on a Sunday morning of May 9th, 1992, an explosion rocked the mine, killing 26 people. There was proof of negligence, but no legal recourse was available to hold the corporation and those in leadership and directing work accountable. The Westray Public Inquiry under Justice Peter K. Richard made several recommendations, and among them was a requirement to amend the Criminal Code of Canada. Justice Richard noted that the Westray story was a complex mosaic of actions, omissions, of incompetence, of mismanagement, of bureaucratic bungling, of deceit, of ruthlessness, of cover-up, of apathy, of expediency, and of cynical indifference. It is a tragic story with the inevitable moments of pathos and heroism, and an event that in all good common sense ought not to have occurred. It did occur, and that is our unfortunate legacy. This past March, it was 20 years since the Westray Law was enacted, and this coming May 9th will be 33 years since the Westray explosion. So this monument that you see on the screen was put up on May 7th, 1993 in Pictou County in Stellarton, Nova Scotia, and it's in a park, and the park is really above the mine site, and the park itself is called Their Light Shall Always Shine. So this is more than a monument, though. It's a tombstone for 11 of the miners who lost their lives that day. John Thomas Bates, Benny Joseph Benoit, Wayne Michael Conway, Roy Edward Feltmate, John Philip Halloran, Randolph Brian House, Stephen Paul Lilly, Michael Frederick McKay, Angus Joseph McNeil, Glenn David Martin, Danny James Popular. You can see on the monument, it's a miner's lamp, and it depicts rays of light emanating out of each side. There's 13 rays of light on each side, and it highlights the names and the ages of the miners. Many of them were quite young, and the symbol is, of the miner's lamp with their light shall always shine. And the park itself and the monument is quite beautiful, but as I said, it is a tombstone. And the reality was the mine became too dangerous. Workers voiced their concerns, and unfortunately the explosion took place and their bodies were never recovered. So when we say no more Westrays, we don't just mean no more mass casualty workplace events. We mean no more workplace deaths without employer accountability. And not every workplace fatality or serious injury will involve criminal negligence, but every worker deserves to have those incidents investigated properly through that criminal lens for the police to make that determination. There have been way too many workers' deaths in the 20 years since the Westray amendments to the criminal code, where employers haven't been held accountable. And that's because of the lack of investigation, lack of evidence, or the Crown decided not to prosecute. So the USW has been calling on the government to make changes that will ensure enforcement of the Westray law. The McIntyre Powder Project. Janice Martel is certainly well known to everybody here, I would believe, for sure, and the incredible work she's done. So in regards to the McIntyre Powder Project, it was a standard practice in mines across Ontario and in other countries for miners to be forced to breathe in aluminum powder, also known as McIntyre powder, before starting their shift under the guise that it would protect their lungs and prevent them from developing silicosis. We now know that the inhalation of aluminum powder simply masked the signs of silicosis to make it hard to detect on X-ray, and that exposure to that powder also caused other illnesses. The Workers' Compensation Board, and also known as the WSIB, had a policy that stated aluminum exposures weren't related to neurological conditions in effect for decades. Miners were denied compensation for illnesses that we now can prove were related to their workplace exposure to McIntyre powder. It was one miner's daughter who lived in Elliott Lake that decided to take on the compensation system because she knew in her heart that her father's illness was from his work as a miner, being exposed to McIntyre powder. The USW is very proud to be among the allies of Janice Martel in this fight and the historic victory, not only in eliminating the policy denying work-relatedness of neurological conditions from aluminum powder exposure, but to now having a presumption of work-relatedness for Parkinson's as a result of exposure to McIntyre powder, and an apology was issued by the provincial government. We are also proud to have Janice as a member of the United Steelworkers family as she continues her fight for justice for workers exposed to McIntyre powder and other occupational diseases. The Diesel Particulate Project. USW Local 6500 in Sudbury partnered with the Center for Research and Occupational Safety and Health, known acronyms are CROSH, at Laurentian University, and the Occupational Health Clinics for Ontario Workers, OHCOW, to work to change the Ontario's legislation for diesel particulate exposure in mining. They succeeded in getting the regulation changed to provide a drastic reduction in diesel emissions. As of September 1st, 2023, the new exposure limit was reduced to a time-weighted average exposure to elemental carbon of not more than 0.12 milligrams per cubic meter of air instead of 0.4 milligrams per cubic meter of air based on total carbon. These are some additional hazards specified in the Occupational Health and Safety Act that we want to also mention that we think is very significant here. Bill 168 received the royal assent on December 15th in 2009, and Bill 132 received royal assent on March 8th, 2016. Bill 168 specified that violence, including domestic violence and harassment, are hazards in the workplace, with Bill 132 later clarifying and including that sexual harassment is a part of workplace harassment. In 1996, Teresa Vince was shot by her boss at Sears in Chatham, Ontario on June 2nd. He had been sexually harassing her for more than a year, and despite filing a complaint against him, the employer took no actions to protect her. Lori DuPont, a nurse at Hotel du Grace Hospital in Windsor, Ontario, was stabbed on November 12th in 2005 by her ex-boyfriend, who also worked at the same hospital. The families of Teresa Vince and Lori DuPont fought for these legislative changes. Employer and supervisor duties to take every precaution reasonable in the circumstances to protect the worker had been a part of the Occupational Health and Safety Act long before the deaths of Teresa Vince and Lori DuPont, or any other victims of workplace violence and harassment. Yet that wasn't enough to protect those workers. It took the very public loss of lives and pressure from the families for the government to specify that protecting workers from violence and harassment was part of the general duties of the employer. Governments need to stop waiting for a body count to make legislative changes, and employers need to take every precaution reasonable to protect workers without having the circumstances stipulated in the legislation. So there's definitely still room for improvement regarding the changes to the Occupational Health and Safety Act for violence and harassment. Currently, there's too much employer control over the issue when it's workers who are at risk. Almost every section regarding violence and harassment in the Act has a reference to a non-existent regulation expressed as prescribed elements, prescribed information, prescribed duties, etc. Employers are required to assess the risk of violence, but there's no such requirement for harassment in the legislation. The right to refuse unsafe work includes violence as a danger to the worker, but it doesn't allow a worker to refuse on the basis of workplace harassment. So we need to have worker involvement in all hazard assessments, and we need a regulation that provides more detail regarding the issue of workplace harassment and violence, and to expand the grounds for refusing unsafe work. So legislation isn't enough. The USW has partnered with the White Ribbon Campaign Foundation organization, the Canadian Football Players Association, and there's this program that we have called Elevating Action Against Gender-Based Violence. So it's really important to address instances of harassment to avoid the behavior escalating to violence. And we need to foster a workplace culture that doesn't tolerate harassment or violence, which is one of the best prevention measures an employer can provide. So when I mentioned that USW has partnered with the Canadian Football Players Association and the White Ribbon organization to provide this training called Elevating Action Against Gender-Based Violence, it's in an effort to change our culture and to challenge gender-based violence in our workplaces and communities. And the legislative change isn't enough. And this program focuses on prevention of gender-based violence to help create a safe work environment for all by encouraging more men to speak up on the issue and to be allies. And this is an effort to protect physical health as well as mental health. And it should be happening in all workplaces for that reason. So these are some ideas for improvement. The first aid regulation to be expanded to include mental health first aid. The first aid regulation, as you know, requires an employer to have first aid supplies and someone who is certified in first aid to provide assistance to workers with physical injuries. It's long past time for a similar provision regarding mental health, and there should be workers trained in mental health first aid to assist those experiencing a mental health issue. Some employers have already started to do this without a legislative requirement, and that shows that the workplace has evolved and needs to adapt for all. The fact that some workplaces have this in place and there haven't been any reports of a negative impact on the business, including productivity, that shows that a supportive workplace is a successful workplace. Employers are required by legislation to provide workers with basic health and safety awareness training. So there should be a requirement to have mental health awareness training, because mental health is a part of your overall health as well as physical activity. A workplace hazard doesn't need to be a tripping hazard or a toxic chemical. It can be a toxic environment that impacts one's mental health. There needs to be the same requirement to address psychosocial hazards in the workplace as there is for physical hazards. We need to foster a workplace culture and society that acknowledges the importance of good mental health while eliminating stigma so that it's okay not to be okay any day. Quebec has mental health included in their right to refuse legislation, and there's no reason for other jurisdictions to have less protection for workers. Workplace inspections need to include psychosocial hazards, and when identified, they need to be addressed. And joint health and safety committees need to be involved in assessing the risks and developing programs, as well as policies for violence and harassment. I have a link up here with a few videos in regards to Elliott Lake's legacy, the miners' fight for safety with the USW Union, and remembering Elliott Lake, as well as a couple of articles, learning from the past and reflecting on the radon tragedy in Elliott Lake. And then there's another one, Enough Hot Air, We Want Fresh Air. And it talks about how the Wildcat miners' strike helped to change Ontario law. So these are some things that we can take pride in the accomplishments of the work that the USW and the labor movement and other organizations that you see here on the screen have been working so hard together to try and improve the health and safety for all workers in all workplaces throughout Ontario and the rest of Canada. Thank you. That concludes my presentation, and I'm happy to take questions at the end of the webinar, or however Val wants this to flow. Thank you.
Great. Thanks a lot, Sylvia. That was very comprehensive and very interesting introduction to the discussion today about the sort of the arc of, and it also predates the Elliott Lake strike, but I think it was very pivotal in Ontario's occupational health and safety culture more broadly, which then of course influenced, thankfully, influenced the culture in workplaces by the creation of the Occupational Health and Safety Act and all the other elements that you talked about. I did make a note that we could entertain a few questions right now, but we do also want to hear from our other speakers. So I don't see anyone in the chat. Is anyone, and I don't see anyone with a hand up. So maybe we'll move to Alan to talk about his research around knowledge activism, and we can see how this all fits together, and then we'll move to John, and then we'll have a discussion at the end.